Yeah, hello dear people. My name is Volker Schmitz. This is Dr. Artour Rakhimov, and this is a new part of our series where we discuss certain topics, different topics related to the famous Dr. Buteyko and his breathing method. And today we want to talk about Western studies which use the method to treat asthma. So, Dr. Rakhimov, what can you tell us about the situation?
Yeah, many practitioners, of course, hundreds of breathing teachers around the world who have been teaching this technique since early 1990s. And many of them, of course, because of teaching hundreds of people, we also get in touch with doctors, like in Australia, New Zealand, especially when it started in 1990s. A little bit later in England and Ireland, kind of became more and more number of practitioners, growing number of people who were learning, and now Canada and United States. So therefore, like what happens with clinical trials, first clinical trials were also like related, mostly conducted in Australia and New Zealand. Later it moved to United Kingdom, and then later would be also Canada, and hopefully United States can be later also involved in this work. So kind of on one hand, it's excellent that people are able to reduce medication, and these trials actually reported that asthmatics are able to reduce the use of bronchodilator somewhere around like 90% in average for these trials, let's say 3-6 months later after practicing breathing exercises, simple, easy, relatively easy breathing exercise and making lifestyle changes.
Which is incredible in itself.
Which is on itself very good result, on one hand, definitely. On the other hand, like we can also think about how Dr. Buteyko viewed application of his technique in relation to asthma and what are the levels which people are able to achieve.
Yes.
So, and that
because there's a problem, I think you want to...
there are not kind of
the
problems,
possible problem
extra kind of benefits, advantages, or possibilities which are hidden in the technique and people are often not aware about. So, and this is also actually one of the questions which I asked Dr. Andrey Novozhilov, who is now chief doctor in the Moscow Buteyko Clinic.
And he wrote a very good book about asthma treatment.
Yeah, he wrote exactly, and he of course had thousands of asthmatics in his clinic as well, while doing a lot of pulmonary and other tests on them as well, with immune system tests and so on. So he is probably one of the most educated, maybe the most educated doctor who knows the Buteyko breathing technique. So, and his view are the same, I would say, as Dr. Buteyko, and my view would be the same as well. So that there are basically, we can say there are 3 levels how people can learn the Buteyko technique, retrain their breathing in relation to asthma. And level number 1, the easiest method, would be to learn the reduced breathing exercise, or we call it the emergency procedure, how to do breath holding and how to reduce breath, in order
to relax at the same time.
Relax, to stop an asthma attack. Basically to have less medication for, I would say probably for most people, they can, mild asthmatics especially, would not require any Ventolin or any other bronchodilator if we apply this technique. And that's the reason why the Buteyko method also became particularly known and popular among people with asthma, because when they apply this method...
they find sometimes even one day is enough, and then they find out
and they see,
it works.
It works in 3-5 minutes, not even one day.
It can for some cases,
And maybe more severe cases where we need half medication, so kind of dependent on the severity of asthma.
A little bit more time.
And this is level number 1, the easiest technique, because you just need to apply this easy breathing exercise. Now level number 2, and that was achieved during these clinical trials, when people are able to move, and here we can refer to the Buteyko table of health zones, because a person with mild asthma, and I've seen a lot of them, would have about 15 seconds for the body oxygen test. So we have quite heavy breathing, the CO2 level is much lower than the norm, the breathing frequency is quite high, so we hyperventilate all the time, of course. That's the reason why we have asthma. And so what happens in these clinical trials, if we find numbers, we actually improve their breath, but we improve their breath only by moving from one zone to another. So only by one zone increase, so from one zone to another. If we think about like types of breathing and what are the degree of either health, super health, or degree of disease, and this is Buteyko table of health zones, which according to Dr. Buteyko is his main discovery. So we can see that we moved only by one zone, and that would be showing us that we achieved only moderate improvements because there is much more way to go. And because of that, if we think about how Dr. Buteyko and his doctors applied the method on people in Russia and Soviet Union, they would apply, of course, they would also work like here we can have like also kind of time-related or psychological factors, because Dr. Buteyko, when he started technique, he worked with hospitalized people who would have a lot of time in hospital, so we would have like plenty of time to do breathing exercises.
And also, you could control the
better control, one of the factors too. And another big factor also, I know many practitioners we discussed in the past that, of course, when it's done by doctors, we have much more authority, because a Buteyko teacher practitioner on the West, most of them, more than 90%, we don't have medical education. We do have doctors, physiotherapists, nurses.
It's a psychological factor because people tend to believe what doctors say.
Yes, when you, of course, deal with official doctor, general practitioner, or family physician, that's a totally different situation. Not totally, but very different situation, definitely. And therefore, we would be more willing to follow, would have more trust, more in the technique itself. And because of that, what Dr. Buteyko found, people with asthma, if they achieve the norm that he established with 60 seconds for the body oxygen test, 8 breaths a minute, 4 liters per minute would be ventilation. Because in this clinical trial, we found that asthmatics can reduce their ventilation from 12 to about 9 liters per minute, but this is still halfway to the norm, so we could go further. So what was found by Dr. Buteyko and his colleagues in Soviet Union and in Russia, that there is a third level of learning for people with asthma. And this level corresponds to the situation when asthmatics are able to have a cleansing reaction from the lungs. So the airways actually get cleansing, and the cilia cells which are present in airways starts to work, inflammation disappears, and we are able to cough out all this old mucus or sputum, phlegm, which accumulated at the bottom of the lungs for people who
does not look nice.
Many years of asthma. It's called cleansing reaction. But after this, what happens here is that after this cleansing reaction, when with asthmatics, if they do lung function test, it would be found that the lung function actually starts to function normally, which we did not have, of course, for years because of having asthma. And this is how doctors also define asthma. We do like different tests, pulmonary tests, and we find out that there is more resistance in airways because of mucus inflammation present in airways, but also often the capacity of lungs due to presence of mucus and all these abnormalities would be also reduced.
And it's possible to bronchospasms,
bronchospasm present,
body,
mucus. It's all like several factors together which makes lung function results worse. But again, while if we are able to achieve normal results for their breathing, to normalize their breathing, these asthmatics are able to get rid of asthma completely. And that should be the goal of the Buteyko technique, as he believed. And that can be, of course, like depending on the person. If there are asthmatics who are up to the challenge, who want to really to get rid of asthma completely, then it is possible. And it's a matter, of course, correct application of the method, having enough time and have enough devotion.
This is a potential problem because sometimes people do not just spend all the time on the method to reach this. So if doctors later test it, they don't have better results for the lung function test if they do not reach this level of, let's say, 45 or 40 cp in the morning, what is needed to get rid of asthma completely. So it's a potential problem, and also a problem with the quality of the practitioner as well, because practitioners tend to bring the people up to the level they have themselves, we found out, so it's another potential
that's a related topic here, because it's, I believe, also kind of psychology related, because people are quite limited in terms of how much time they are able and willing to invest. But that also kind of, in my view, totally relates to the lack of understanding how many benefits are hidden later in the technique, because there is certain initial investment when people make, but later, let's say if somebody achieves CP up to 60 seconds, the sleep is dramatically reduced, so people get much more time for doing breathing and physical exercise, and breathing exercise later become less and less necessary, less and less important as well, because it becomes more natural to do, and physical exercise takes the main portion of breathing retraining in terms of time investment. And of course, lifestyle changes is a separate topic, like which changes, adjustment people need to make in their sleep, in their diet, and other factors. So there is a kind of potential problem here related to low CP, also of generally Buteyko teaches on the West, because when practitioner has certain level of breathing, let's say like minus fourth, minus third degree of disease according to Buteyko table of health, like with CP 30 seconds, and many practitioners...
Which is actually quite common, as it seems.
Yeah, among Buteyko Western practitioners on the West, it's quite common to have 30 seconds or less for the morning CP, and what is probably even bigger problem here, like kind of a more important factor, is that these people never had the situation when they had up to 60 seconds and high numbers.
So they do not know the benefits
they never experienced
practical experience.
Yes, we did not have practical experience of this state, of health state. And therefore, this is what Dr. Buteyko wrote, and his colleagues even discussed, like the effect relates to that these teachers will not teach their students to achieve these higher levels. We would teach them to the same level as we achieve. And that would be again like 20, 25, 30 seconds as we had in these clinical trials. Whereas Dr. Buteyko advised, and it was not 100% of doctors whom he trained achieved this level, but there were many who had 60, 90, and there were also those who had up to 2 and 3 minutes for the CP test with 2 hours of sleep and many other benefits. And therefore, of course, the application of the technique was and even now much more professional in terms of how we teach it and which level we target to the students. A related effect here kind of comes from my practice, because during last 10 years when I teaching also people online, like not only live courses, which I started about 15 years ago to teach, but while teaching people on Skype online, I had many students every year. I have many of them now as well, who trained with some other practitioners, and we achieve improvements. But later either we get stuck, or we get some symptoms, or we get like some situation change, and we get in touch with.
They often do not need medication anymore. That's of course a huge success for those kind of people.
And what happened with them that when we come and start learning with me, I realized I found that it was much more difficult for me to convince them and to kind of progress them to the level when we had much higher CP, because I call it like psychologically the first teacher effect. In psychology, there is a known first impression effect. When people get impression about certain new area or topic, this first impression can last later and can kind of be projected on later events.
It's very well known that to unlearn something may take longer if to
it relates to probably unlearning as well, But the first teacher effect, I believe, kind of it's a much stronger effect, because let's say if you want your child to go and to learn some like football or soccer skills, or to learn chess, or to learn playing musical instrument, or gymnastics, or to go to send a child to ballet school. You have choices which teacher to choose. And if your teacher is average teacher, you would not expect your child to excel and to achieve really super high level, like to be like maybe at the world level or professional level later. So if you want your child to be like having excellence some years later, you would select the best teacher, even if this teacher may be far away or some other place, because in this case it would be definitely much higher chances for your child to succeed years later if the first teacher provides basics, even because first teacher would often just whatever the time, 1 month, or if it's longer, takes 1-2 years, would provide just basics in this area, and would take maybe years to learn it later. But the first teacher effect would be huge in all these areas. And because of that, I believe also in relation to learning the Buteyko technique, for some reasons I found that I had so many students who would learn from my website, and they get CP 60, 90 seconds and higher, which is not often, but there are such people, even from paper, which like really looks kind of very impressive, because it's really hard technique to learn without a teacher in general. But when people learn from a teacher and they do not get these ideas about importance of Buteyko table of health zones, and having these great benefits of super health because the practitioner itself never experienced these effects. That of course produces an impact so that these people they get stuck, they of course solve problems with medication, for example, for asthma.
And they feel a lot better.
And they feel a lot better, they can function like ordinary people.
But they don't have an idea that this will even...
That can, of course, dramatically enhance the other lifestyle-related factors and quality of life as well.